computer. So as our attendees start to filter in, I'll turn it over to Sage to give the welcoming for everybody. There you go, Sage. Just go ahead. Yeah.
Hi. Good afternoon, and everyone. Thank you for attending Gateway's ongoing virtual lecture series. My name is Sage Milne, and hidden over here is Jay McFarlane, and I'm a research assistant at Gateway Center of Excellence in Rural Health. Gateway is located in Goderich, and to our knowledge, is the only rural health research center in Canada governed by community-based volunteers. We are partnered with several academic institutions and healthcare facilities, and we appreciate all the support all these participants are providing, and all of our wonderful speakers in providing the support to the local knowledge economy. Gateway's mission is to improve the health and quality of life of rural residents through research, education, and communication. And to thank those that are ongoing attendees, we give diplomas at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this education series. Although not the topic of our lecture for this month, Gateway would like to acknowledge that in Canada, the month of June is Indigenous History Month, and tomorrow, June 21st, is Indigenous Peoples Day. These peoples include the Métis, the First Nations, and the Inuit. The Gateway office is located on the land belonging to the Attawaddaran along the Anishinaabe, Haudenosaunee, and Neutral people, and this land served as their traditional hunting grounds. We recognize the Upper Canada treaties signed in regard to this land, which include Treaty Number 29 and Treaty Number 45.5, and our roles as treaty people to moving forward in the spirit of reconciliation, gratitude, and respect. Today's lecture is on Fabulous at Every Age, Healthy Aging, presented by Dr. Alexandrea Peel. And Dr. Peel is a rural geriatrician and Gateway's own research chair of rural senior care. And she works primarily in the rural community of Wingham. She's an adjunct professor of geriatric medicine at the Schulich School of Medicine and Dentistry and adjunct professor at School of Pharmacy at University of Waterloo. And joining her are the panelists, including Dan Stringer, who's a retired pharmacist and chair of the board of directors of Gateway Center of Excellence in Rural Health, and then Dianne Fox is a retired RN who has worked in the clinic with Dr. Peel. And then we have Kathy Scanlon, who is the executive director at OneCare, a not-for-profit health organization that provides support for seniors and older adults in Huron and Perth counties.
Okay, we'll turn it over to you, Alex, to take it away.
All right. I'll just bring my slides up here. And I can see from the queue that we had about 30 people who have joined us. So I just want to thank everyone, my panelists, and everyone who's joined on today to listen to this topic that I'm really excited about and I think is really important. So let's dig into it. So just a couple disclosures. I have no financial relationships to any commercial entity. This is my personal opinion guided by research. So in terms of the objectives for today, we're first going to talk about sort of defining healthy aging and trying to figure out exactly what that concept means. Our next objective is to discuss some of the factors that are associated with healthy aging. And then the last objective is to talk through some really practical things that you can do to age well. So when I was planning for this talk, there is a lot of definitions in the literature about healthy aging. But what I've tried to focus on is sort of a more holistic definition of healthy aging, which is basically the concept that, although getting older is inevitable, And although some degree of chronic disease is very common, we can still be physically, mentally, and socially well despite all of those factors. And that's what we're going to talk about today. All right. So the first question that I'll put out to the audience is how much of our lifespan is predetermined by our genetic makeup? So just so that we don't keep you in suspense, about 25 to 30% of our life expectancy is determined by our genetic makeup. The other 75% is determined by lifestyle factors that we have control over, which is actually really good news, and we're going to jump into that. So people often will ask me, well, if only 25% is determined by our genetics, how does that actually work? Like, how can our lifestyle factors, alter our body so much? So that is the concept of epigenetics, which is how basically our behaviors and our environment change how our genes work. So to give you a little bit more practical understanding, we all get half of our genetic material from our mom and half from our dad, and that comes together to form our genes. And that is sort of like our recipe book. And then from that recipe book, our body takes out all the different, it accesses different recipes at different times to make all of the cells in our body. And it also uses different recipes at different times to make all of the proteins and enzymes that make our body function. And so epigenetics is figuring out which genes are going to be accessed at which time. And so aging starts to happen when we stop using or when we stop accessing those recipes. And that's called cellular senescence. And so when those cells stop accessing the recipes and making the proteins and enzymes that they need to, that causes a lot of inflammation and damage in our body and starts to damage other cells around these cells that are no longer functioning. What can also happen is the cells can actually die, and that's called the process of apoptosis. And then our organs can start to have functional problems, and we can even get problems with things like cancer when a cell might start to divide uncontrollably. So a really, I think, easy to understand example is cigarette smoking. So I think we can all understand that, if we smoke a cigarette, that might damage our mouth and our lungs. But how do we explain that cigarette smoking causes damage all over our body, and even things like osteoporosis, which don't even seem linked to cigarette smoking? And that's actually been studied and been found to be this whole concept of epigenetics. So when we smoke cigarettes, over a third of the genes in our body will become methylated, which makes them inactive. And then this leads to sort of all of those side effects of cigarette smoking. But a really neat thing that's also been determined is that when we stop smoking, those genes will actually unmethylate and will start accessing the right recipes again. And we have the ability to start to reverse some of the changes that were related to that cigarette smoking. And that's where this concept of inflammaging is also connected. So we know that we have these vascular risk factors, right, that increase damage to blood vessels and can lead to heart attacks and strokes and dementia or memory impairment. So the elevated body weight, high blood pressure, diabetes, and smoking. And in terms of how they do that, they cause inflammation in our body. That then leads to these epigenetic changes. Our cells change function and stop accessing the right recipes, and we start to age more rapidly. I apologize here. I need to put my phone on do not disturb. All right. So the next question I'd like to pose as we shift gears a little bit is retirement good for you? This is one that I get asked quite a lot. So when we look in the literature, is retirement good for you? what we see is those with high performing or high stress occupations tend to have improvement in their mental health after they retire. But when we look at the population level, the majority of people who retire will actually have worse physical and mental health after they retire. And the thought is that that is mitigated, or sorry, that is caused by a reduction in people's overall physical activity and a reduction in their social interaction that happens after retirement. And of course, you know, the data is quite heterogeneous, right? Depending on culture and health and socioeconomic status. So everybody's case is a little bit different. And we know that we can mitigate this effect a little bit. So for example, if you're married or you have a very strong social support network, these changes will tend to be less. Also, if you're very physically active post-retirement, these changes will be less. And if you continue to work part-time. So in terms of, I think what the overall message should be is that it's important not just to retire from something, but to retire to something. And I think we're going to spend, you know, the rest of this time kind of talking about, you know, what some of those somethings might be. So we're going to shift to talking a little bit about physical exercise. My question here to the audience, how much longer on average will you live if you meet the Canadian exercise recommendations? So from the studies, they say about 4 years longer. But I think what's more important than living 4 years longer is that you have less incidence of all of these chronic conditions. And if you have these chronic conditions, you tend to have a better outcome. So in terms of how much physical activity is actually recommended, a current guideline suggests that any person, especially a person over age 65, would exercise at least 150 minutes a week of moderate to vigorous physical activity, that it would be in sessions of 10 minutes or more. And ideally, we would add in some bone strengthening and muscle strengthening activities. And in terms of what moderate exercise is, that means that, you know, you're exercising, your heart is beating, you can still talk, but you probably couldn't sing. And vigorous physical activity is sort of when you can't talk and when you're kind of feeling winded. But I think most people, when I give them that exercise recommendation, typically kind of look at me with a side eye and think, well, you know, 150 minutes and moderate to vigorous, like that's a lot. What can I sort of practically do? So there's a really interesting study that was actually conducted in Taiwan. They followed over 500,000 people for 13 years. And what they have shown, I've kind of tried to illustrate with this graph. And so when you look at how much physical activity is sort of the minimum that you would have to do to start getting health benefits, what we see is that at about 10 to 15 minutes a day, 6 days a week, people start to get a reduction in risk of dying, reduction in cancer, and a big reduction in chances of dying of cardiovascular disease and sort of all of those cardiac complications that we kind of had talked about previously. And that was irrespective of people's underlying health conditions. And what you can also kind of pull from this graph is, yes, maybe vigorous activity is more beneficial than moderate activity, but the bottom line is you start to get benefits right away of physical activity, even at that 10 to 15 minute mark. So if you can't meet the 150 minutes a week, start with 10 minutes a day. So I think what I tend to suggest to people is to get a comfortable pair of shoes that, you know, anybody can do 10 minutes a day. Even if you have no time, it can be done, you know, before you start work or when you're on a break or at lunch or after work. It doesn't have to be something big, but it could just be to your mailbox and back. It could be around your laneway once. It could be around your farmyard, around your block, but just take that 10 minutes and walk. Another program, which I really recommend for people, especially if they're trying to get the bone strengthening and the balance exercise, would be a falls prevention exercise program. So these are sort of a public health initiative. They are across Canada, and in our region, they're run by VON as well as by OneCare. And this is like a 60-minute physical exercise program, and we have 3 levels. So it is inclusive for everybody. Level 1 would be primarily in a chair for people that have very limited mobility, whereas level 3 actually provides a moderate to vigorous level of physical activity, and it allows people to participate at any intensity. So we'll talk later about how to connect to some of these community support services, but this is certainly another one that I recommend to people because it's affordable and accessible in our community. So shifting gears a little bit, let's talk a little bit about positive attitude and aging. So is your cup half full or half empty? So this was a study where they looked at 600 Americans, and they surveyed them at baseline and asked them about how much they agreed or disagreed with different statements around aging. So for example, how useful are you as you get older? Or how happy are you now compared to when you were younger? And when they followed these people over 23 years, people that answered positively to many of these statements around aging lived on average 7.5 years longer than people that answered negatively about these statements. And the hypothesis is, again, that we sort of develop these stereotypes as a younger person, and these stereotypes seem to affect our self-perception or that sort of will to live as we get older. And so I think all of this is good information, but I have a lot of people tell me, well, I can't change my attitude, like my attitude is what I have. Right. And actually, the literature shows that you can change your attitudes. So using the process of cognitive behavioral therapy, we have the power to separate what is fact from what is a thought and what is the feeling that comes from that. So a classic example would be something like seeing a dog, that is a fact. Some people might have a thought, that's the cutest dog ever, and run over and pet it. And other people are like, that's the scariest dog I've ever seen. And they might, run away. And that's their thought, right? And, we have the power to change that. And so things that you can do, right? Make a list of things that you're grateful for and review it often. Spend time with people who are positive and less time with people that are not. Challenge these unhelpful thoughts. What would a friend say about whatever you're experiencing? What is the fact here and what is just the thought or the feeling? So this infographic is reflecting a report that was published by the US Surgeon General back in 2017, and it made headlines in the news. And it was basically just looking at the odds of premature death in people that were not considered socially connected. And what they kind of showed is that, being socially disconnected, not having that social network actually has a higher chance of death than smoking 15 cigarettes a day, drinking 6 drinks of alcohol a day, being obese, not being physically active, sort of all of these factors. Which I think, it's pretty striking, and especially given we've just come through the pandemic where people have been so socially isolated for so long, it's something that we really have to focus on. So, in terms of how do we actually measure, like social connectedness, so there's kind of 3 variables, right? So one is the structure. So that's sort of the number of relationships that you have and kind of how frequently you might interact with them. The second is kind of the function of those relationships. So do they actually meet, whatever needs you're having at that time? And then 3 is kind of the quality. So, is it actually a satisfying encounter, when you have that kind of social connection? And so what we can do is we can we can try to work on the number, or we can try to work on the function of those relationships, or we can try to work on the quality, right? So in terms of things that you can do to, increase that social connectedness, calling a friend who you haven't talked to in a while and just asking them if they want to go for coffee or go for a walk, volunteering something, joining a group or joining a committee, going to an event, even if you're going alone, making the most of your hobbies and interests and seeing if, there might be a group that you could join connected to a hobby or interest, confiding in someone, looking at the activity program for your local senior center. So we have the McKay Center in Goderich, St. Mary's has the Friendship Center, and then One Care actually has a virtual senior center, which can be for anybody, and they can connect in from home to different conversations. There's something that occurs 5 days a week in the afternoons. And the other thing I just wanted to kind of highlight quite quickly, this is a listing of some of the community support services that we have locally. So if you are, if there's certain barriers to why social connection is a struggle, for example, transportation, our local community services, community support services can help assist with that transportation. Or, if you're interested in having a meal with other people, they can help with getting you into a dining club. If you need to get out for a day, just to be around others, have a meal, play cards, listen to music, whatever it is, we have the adult day program. It is, there's a proportion of people that attend certain days of the week that is more towards memory impairment, but there's other days where it is more towards just social connection of people that are isolated. So if you're interested in learning more about these community support services, I've listed the number for the central intake for community support services for both Huron Perth and Grey Bruce. All right. So next, I'd like to talk to you a little bit about the importance of lifelong learning and the connection to developing dementia. So this is a study. And basically, they studied, I believe it was around 20,000 individuals, and followed them again for about 15 years, and looking specifically at how much they are reading at the baseline and reading over time, and then their incidence of developing dementia. And what they showed was that those who read more than an hour per week have almost a 50% reduction in their dementia incidence over the course of the study. And then there was a similar study that was looking at how much time people were spending on hobbies and their instance of dementia. And again, same sort of thing. The more time you spend on your hobbies, the less likely you are to develop dementia. So again, we don't always know correlation is not causation, but we need people to be always engaged in lifelong learning pursuits to kind of improve that longevity and reduce that risk of dementia. So again, some, very practical things that you can do, read, as I mentioned before. You can do writing, word searches, number puzzles, choose something that you enjoy. Visit your local public library, talk to the staff about what upcoming lectures they have, or, is there any books that you might be interested in? Make the most of your hobbies, again, by joining a group that's connected to your hobbies. Learning a new skill. So maybe how to use a computer, how to do photography, how to edit your photographs, how to quilt, how to garden. It could be anything. Challenge yourself to learn a new language or a new instrument, or even register for a course through adult education. So several of the universities actually have courses that you can enroll for with very minimal tuition commitments, just to gradually accrue course credits, which can be a really fun thing for people to do. So next, I'd like to touch a little bit on diet and aging. So I find, a lot of people will tell me about sort of the different diet that they're doing, and what great results that they've had from that. And if we're looking specifically at dementia, often we're recommending maybe a Mediterranean style diet, or what's called the MIND diet. But it's difficult for people to completely switch, from one diet to a completely new diet. So what I tend to recommend is sort of a more balanced approach. And, I'll pull up another slide. So this image of a dinner plate is taken from the year is escaping me now, the 2021 Canadian guidelines on healthy eating. And what you will see is that dinner plate is 1/2 fruit and vegetables, 1/4 of your whole grains, right? And another 1/4 is sort of dedicated to proteins. And within those proteins, right, we want to try to have some, so such as beans, lentils, seeds, that kind of thing. And we also know that we're trying to shift more towards sort of some of the leaner proteins, so like your fish and chicken. And so, big kind of summary points that I would take from that is, like, if it came from a plant, it's probably a good thing to eat, right? And if it's made in a plant, it's probably not as nutrient dense, right? So that's where we want to kind of focus on those fruits and vegetables, whole grains, kind of piece of things. The other thing that it's almost cut off at the corner there, but what they recommend is that we drink mostly water, right? So things like juices and pops are not considered sort of a first line beverage that we should be drinking regularly. So, other things to think about that they recommend are cooking at home as much as possible, to reduce the amount of that takeout food that we're getting, which is, again, doesn't sort of meet this criteria. They also recommend eating with other people as a very important factor, as opposed to, sitting in front of TV and eating alone, and maybe not always making sort of those best possible nutrition choices. And then the other kind of big message from the guidelines is, again, just sort of avoiding things that are really high sodium. So that's your, prepackaged and processed things, avoiding things with a lot of added sugar, which is, anything that's, again, packaged and processed, and avoiding things that have a lot of saturated fat, which again is sort of that packaged and processed piece. And so, if you're really curious, I recommend that you see a dietitian, so that they can give you some specific recommendations to, whatever your health status is. But I think a lot of us can, even make the first step of, trying to get more fruits and vegetables into our diet. So I appreciate everyone bearing with me. So I think we all know that, sort of the mouth is the first portal to knowing how our body is doing. And what we know is that poor oral health, where people are getting cavities, losing teeth, gums are receding, is often a marker of poor systemic health. And whether that is correlation or causation, we don't exactly know, but I really encourage people to maintain their oral health as much as possible. And that would involve, seeing your dentist regularly, flossing your teeth at least once a day, remembering that, over 1/3 of the surface of your teeth will be missed if you're not flossing. And brushing, the recommended is 2 times a day, but at least before you go to bed. And the goal with kind of maintaining that is that sort of connection with oral health and overall health. So a few notes on sleep. So this comes up very commonly because as we get older, concerns with insomnia and not getting enough sleep become increasingly prevalent. So up to 40% of people over age 65 suffer with concerns related to sleep. And, some of that is, a chronic insomnia and the fact that sleep does tend to decline as we get older. But part of that can be related to underlying health conditions. And the real concern with this is that over the last 10 years or so, we've kind of discovered that our brains or use sleep in order to kind of flush out all the bad stuff. So if you want to think of it as sort of that way of kind of cleaning things out. So all day, all the cells in our brain are metabolizing, they're making waste, that waste builds up. And during nighttime, when we're sleeping, a system called the G lymphatic system flushes all of that stuff out. And, why that is increasingly becoming important is because things like beta amyloid, which is the toxic protein that builds up in Alzheimer's disease, are not cleared from the brain when we do not get adequate sleep. So, all of this to say is that we really need sleep to prevent these toxins from building up and causing dementia later in our life. So I think the next thing that people will ask me is to say, well, okay, I'm not getting good sleep, so I should probably take a sleeping pill. And, unfortunately, sleeping pills are not something that I typically recommend. What we know from the literature is that, if you take a sleeping pill, but 1 in 13 people will get to sleep a little bit quicker, and they might get a little bit more sleep, but about 1 in every 6 will develop cognitive impairment from that sleeping pill. There'll be an increased chance of falling down and breaking a bone. And their, equivalent impairment is that equal to, drinking alcohol. So, sleeping pills probably aren't the answer to kind of restoring that sleep and getting that proper flushing of the brain at nighttime. So what is recommended or what has been shown to be more effective than sleeping pills? That is what's called brief behavioral therapy for insomnia. So that's a term that you can Google and kind of get more information about what it involves. But basically there's 2 components, one called sleep restriction therapy and one called stimulus control. And we'll talk a little bit about kind of each of these. So this first part is the sleep restriction therapy. And basically what you do is you look back on the sleep that you've had over, say, the last 2 weeks, and you calculate on average, how much time have you actually spent sleeping at night? So, let's say you went to bed at 10, but you laid there until 2 and you got up at, say, 8. That means that you got like 6 hours of sleep on average per night. And then what you do is you set a wake up time. So maybe that wake up time is going to be 8 o'clock in the morning. And then you take that wake up time and you walk backwards with the average amount of sleep that you've got. So I think I said 6 hours there, but in my example that I've got on the slide, I said 5 hours of total sleep. But basically, you walk that back, and then that becomes the time that you go to bed. And that 8 o'clock in the morning is the time that you would always wake up. And then what we encourage people to do is, most people are tired if they wait till 2 o'clock in the morning to go to bed. And they will just increase that sleep drive. They will gradually be able to sleep better. And you will lengthen that time out by 20 minutes every week, let's say, until you kind of find that sweet spot of what time you're actually able to go to bed, be tired, and get up at that same time every morning. And I think where people run into problems is they would then nap a lot during the daytime. And, if you're going to nap, it should probably be less than about 30 minutes because it will reduce your sleep drive, right? And make it that much more difficult to fall asleep at night. So in terms of what the stimulus control piece of things is, that kind of, connects to some of these pieces that I was just mentioning. But the first thing is just making sure you get bright light during the daytime. ideally first thing in the morning. So that's where you can, put in that recommendation about going for a walk for 10 minutes. But that will help kind of reset the circadian rhythm, which helps us to go to sleep at night. They say you should only go to bed if you're sleepy. You should not be in your bed, for anything except for sleep and sex. No TV, no reading a book, not eating, don't worry in your bed, right? So only for the S factors. If you've gone to bed and you're not sleepy, get out, turn your clock around so you're not watching it. Wake up at the same time every morning, whether it's the weekend, whether you have something on or you don't have something on, and trying to limit those naps probably to 30 minutes, because more than that, and you'll start to affect that sleep drive at night. So another question I commonly get around sleep is this idea of sleep apnea, right? And so, this is a condition where people don't breathe enough at nighttime. So they can end up with low oxygen and elevated carbon dioxide, which is very damaging from an epigenetic perspective, right? It has wide-ranging effects kind of all over the body. And it is becoming increasingly prevalent, just kind of connected to sort of all of these vascular risk factors that we've sort of talked about. And I think, many people are hesitant because, to get assessed for this condition, you have to go sleep in a sleep lab, which is not going to be your best night of sleep. And then, maybe someone, if you have severe sleep apnea, they might tell you you can't drive until you get treated, which is, that's a big thing, especially in a rural area. And, and then if they, treatment is individualized, but for a lot of people, it can be the CPAP machine, right? And I think a lot of people have concerns or fears kind of around that. But what the reality is that, if you do have this condition where you snore and you stop breathing, it is very damaging, and it will cause these wide-ranging effects all over your body, including cognitive impairment, including higher risk of stroke and heart attack, including depression, higher risk for diabetes and obesity and, risk of car accidents. So the bottom line is, and what I found in clinical practice is the majority of people, if they have severe sleep apnea and they get it treated, they feel dramatically better. And that's really what I want for everybody. So if you do have this condition, please see your doctor and get treated, and you will have better sleep quality and better longevity. So I hope everyone is sticking with me. We're getting close to the end of my part. But my next question for the audience is, what is the most common cancer in Canada? All right, and so the answer is actually skin cancer. So the incidence of skin cancer, so melanoma and non-melanoma skin cancer, is equivalent to the combined incidence of lung cancer, breast cancer, colorectal cancer, and prostate cancer, all added together. 1 in 5 of us will develop skin cancer in our lifetime. This is a condition called actinic keratosis, where people will get rough and scaly and oftentimes red patches. It will look different on different colors and different textures of skin, but basically, you're feeling for that kind of rough and scaly change on your skin over time. And I think, you can see this, look at any farmer, right? Or any worker who has, been out in the sun for long periods of their lifetime with, limited sun protection. And, this is a forehead or a hand that you could see. And, this is this is not cancer, but this is a pre-cancer lesion, right? And so these lesions have to get treated so they don't go on to develop kind of squamous cell carcinomas, which can metastasize, to our whole body and limit our life expectancy. And these here are other kind of common things that I will see in clinic. So, you see this person here with the cloudy eye, that's a cataract. This person up in the top left here, they've got kind of an age spot, it would be called. This person has these easy bruises on their arm. We call that an actinic purpura. And this shot here of skin is just basically showing sort of that thickened and leathery and kind of wrinkly skin. And sort of what do all of these conditions have in common? These are all sun-induced conditions, right? The UVA and UVB rays from the sun, go on our skin, and they cause all of those epigenetic changes that we've talked about. The cells become senescent, the cells die, and we start to end up with some of these conditions. So the recommendation is that we would all wear a broad spectrum sunscreen, at least SPF 30, applied every day to our face, the backs of our hands, and kind of our neck area. And I mean every day, like whether you're inside, whether you're outside, no matter what you're doing, that is the recommendation. And then of course, if you are going to be outside, you should apply that sunscreen to every part of you that's exposed and reapply every couple of hours. Now, other important recommendations are to wear a wide brim hat, have UV protective clothing, seek shade, and wear sunglasses to protect your eyes to reduce that incidence of cataracts. But if we all did this, that would have an enormous impact on the incidence of the sun-related conditions and of skin cancer. All right, so, did just want to quickly highlight, this is the new Canadian guideline on drinking alcohol. So in the past, the guidelines were more based on limiting alcohol such that people wouldn't go on to develop liver disease from the alcohol. The new guidelines are taking sort of a different approach, and they are looking at all of the harms of drinking alcohol, including risk of cancer, vascular risks, risk of cognitive impairment, risk of social dysfunction, and those kinds of things. And what we sort of see in the literature from that is anyone who's drinking more than 1 or 2 drinks of alcohol per week is at increased risk of alcohol-related complications. And so, that old adage that, probably 1 glass of wine a day is, especially if it's red wine, because that's on the Mediterranean diet, that would be good for you. What we sort of see now is that we're recommending a much lower alcohol consumption. And this is very new, like just as of the last couple of months. And my computer's just trying to restart on me here, so we'll pause that. So, if you have found this talk interesting and you want to learn more about healthy aging, I would definitely check out this website called the Fountain of Health. They actually have an app. When you go on the website, you can do a little health assessment. You can work on kind of goal setting. It gives you a whole bunch of different suggestions of things you can do to kind of work on these factors that are associated with healthy aging, and gives you some really concrete recommendations. So certainly something to check out for more information. So with all of that said, I just want to thank everyone for their attention today. If you do have any questions, feel free to email me. And we're going to switch over to our panel discussion. So if you have questions, please put them in the chat. And I will pose them to our wonderful panelists, and I have some questions for them as well. So just let me open up the chat here. Maybe I can. All right. So I guess I'll let you guys unmute as you would like. So the first kind of question here. So I agree that aging well means staying physically, mentally, and socially well. However, city planning in North America, especially in rural communities, does not seem to be conducive to this. The reliance on cars, grocery stores on the outskirts of town, not enough free social spaces, means that seniors can be less independent later in life and need more support compared to many European countries where seniors can be independent socially and do well for much longer. And I don't know if the panelists would like to comment on that question. I mean, I have some ideas as well, but.
Well, I'll jump in, Alex. That comes from one of our research associates who's working on her PhD in Vienna. So she's seeing that European model firsthand, and I tend to kind of agree with her to some extent. But yeah, I'm sure Kathy would say yes, but there's all these other supports built into our society, and we would be lost without those, I'm sure. But yeah, it's just the way we've grown up. We've had lots of inexpensive land to develop outward, and Europeans have not. So you see a change in the physical structure of urban areas.
Just to add to that, Dan, I think that's really true that there are, we have a different history here, but there's also lots of possibilities for the future. We have services now that are designed around where the issues and the realities that we've had. There's also exciting opportunities for how we might do things differently in the future. So work with municipalities, thinking about the way we do housing and clustering, and then we can build resources and services around those things in hubs. I think there are some wonderful opportunities that we can think about for the future.
Are you able to comment, Kathy, on any of the kind of projects that OneCare has been involved with recently?
Well, we don't have a specific project it's quite like a European example, but I can see possibilities for where we can build on things we already have. For example, we have assisted living, which is kind of in community hubs, extra supports in clustered areas. And we could definitely build on that with additional services, outreach services that might support people in an area. I think one of the exciting things about that is not only people being in a cluster, but it's the social elements of that as well, being close together, as well as making services more accessible.
And Dianne, I can see you wanting to comment on that as well.
Well, I was just going to say, we've had difficulty with transportation forever. I can remember going to district council meetings where they were trying to work out how is this going to happen. And I think some of the problem that we have in the counties is that people aren't aware of actually what is available or what to do about it. So who is that friend that you call, or who is that, we can encourage people to reach out. But if they don't know who to reach out to, or that there even is an issue, then it becomes a little more difficult. So I find too that it's this transportation. I've been asked that by a lot of my patients that I've gone to see is, I'm thinking of giving up my driver's license, but who will take me? And I don't want to bother my family. And so that is a huge, huge issue that I think that's been going on for a long time.
Mm-hmm. Like, I'm sure Leslie is probably an expert, in this, but there is, so the WHO came out with this whole concept of age-friendly communities, and Canada was actually selected as a site. So there were multiple kind of towns, some rural, I think some more urban, that were selected to kind of come up with this age-friendly communities program. And I didn't talk about it in this presentation just for time, but I will put the link kind of in the chat, because, for our policymakers, there is a whole guide there on how, to create an age-friendly community. And it has suggestions that are practical to across Canada, right? Because, our reality is a bit different than reality in other people's areas. So we just need to kind of utilize, I think, some of those resources when we are doing our planning. So I'm happy to share that one.
Yeah, and if I can just jump into one further comment to what Dianne was saying, one of the reasons that you had showed a slide at one point, Alex, about Community Support Services Network, which is focused in OneCare, but it's and access for all of the community support services agencies in Huron and Perth. And the idea of that was exactly what you were saying, Dianne, is that struggle that we have around people not knowing where to go. And so we thought by working together and creating that one place people can call, that we can help direct people. One of the difficulties is even, and we were actually talking about wanting to do some more publicity around that in the coming year, because it's been there for a while. It's one of those things perhaps people don't think about it till they need it. And so trying to get out there, get people connected at the right time is one of our challenges.
And Kathy, I imagine too, like the transportation services, they're probably the limiting factor a lot of times is like the number of volunteers available too. Like I'm thinking, right? So if we had an unlimited number of people that had stepped up and volunteered as part of the volunteer driver service to help people to kind of get, where they need to go, it wouldn't be that same, piece around some of these services too. So, that's another, if you heard this talk and then you heard like volunteering would be good for you, maybe, connecting with Kathy or calling, I think you can call the community support services central intake line and say, hey, I want to volunteer. Right. And see what the volunteer opportunities are available presently. So that might be a good kind of as well.
That's absolutely right, Alex. Like we have our transportation services, we have accessible vehicles with paid drivers. And we also have volunteer drivers who drive using their own cars. And we also contract sometimes with taxis. So there's a whole variety of things that we try to do to make services accessible depending on what people need. But you're absolutely right. A lot of that depends not only on funding resources, but also on volunteers, because that's one of the biggest areas is people helping people. And it's just huge. I mean, that is community supports. That's what makes our community strong, is people being able to help each other. And there's so many ways people can volunteer.
Okay. So we have a whole bunch of questions in the chat. So maybe I'll skim through some of those and see what we can work on here. So the next one is for sleep. Any comments on CBD oil to assist with sleeping? So maybe I'll kind of jump in a little bit on that one. So I would consider CBD oil sort of the same way that I would consider any sleeping medication, right? There's probably a spectrum from, things that are most dangerous to things that are least dangerous. But in general, if you're taking a medicine for the purpose of sedation, it's probably going to have potential adverse health effects. Now, that said, I think, if say you have some condition that requires you to have a medicine for insomnia, CBD is one that could be considered. I think there's a lot of challenges with cannabis in general, right? Because we have products that are more towards the CBD and we have products that are more towards the THC, and THC is, tends to be a little bit more sedating maybe, but also tends to have sort of more of those cognitive adverse effects. So I think the bottom line there is, there are lots of really good resources. Like if you don't have one, I'm happy to, people can email and I can send you them, but basically to help you in navigating and figuring out, is CBD something that's going to interact with your other medications, or is there a particular risk with your health conditions, and to help you, if you want to go that route, like what kind of preparation or how much or how would you dose it? But, I guess the overall is just that, I consider it under the class of kind of any sedative that you're going to be taking. Now Dan is a pharmacist, and I think he's wanting to grab at that question as well. So you're muted, Dan.
No, I'm okay with that. I just, I think that your advice regarding developing good sleep habits is going to be far more beneficial than any other artificial aid. And I believe CBD oil is just the flavor of the year, or the flavor of this stage of life for many people. And it's being turned to for all kinds of things as the magic elixir, and it isn't.
It's just it's marketed as safe and natural, right? And the reality is many of our medicines were initially derived from plant-based compounds, right? So, you know, whether it's made in a lab or whether it's grown, they're all based off the same thing, but it can still have adverse effects. It can still have drug interactions. It needs to be considered in the context of your overall situation. Okay, so next question. Any research on the effects of long-term exposure to noise, i.e. planes, leaf blowers, motorcycles, and traffic noises? Go from a loud to a quiet environment, and you will, oh, someone's answered this, and you will experience this. The Yukon is astonishingly quiet and a relief from living within earshot of major noise sources. I personally am not aware of any studies that have looked at sort of noise pollution and longevity. This is sort of peripheral to your question, but we know that hearing impairment, so let's say you have long-term noise-induced hearing loss, not having that corrected, so not having hearing aids or cochlear implants does increase the risk of developing dementia. So if someone does have a hearing impairment, I would certainly recommend getting that treated, but I'm not familiar with noise pollution specifically. I don't know if anyone on the panel is. Oh, Jay, you're muted. Are you talking to us?
No, I would say it
Yeah.
looks like there's not much of an expertise on sound pollution with our panel.
Okay, we'll have to park that one for now.
Yeah. Sorry to interrupt you, Dr. Peel, but we do like to wrap up by 1 o'clock and get everyone back to their work schedules and whatnot.
Yeah.
So I'll turn it over to Sage just to give a thank you and kind of wrap up the conversation. But I'm sure we could talk about this for another hour.
Well, I could.
For sure. And then to all the attendees, to all the panelists, and to our wonderful lecturer, Dr. Alex Peel, we hope that this conversation has been a wonderful experience and has invited people to gain new insights on aging and the relationship between aging and health. There are challenges and changes that occur through our lives as we age, and that experience of that process invites new opportunities and can change our day-to-day lives. And as we conclude this lecture, Gateway hopes that we have demonstrated that we continue to cover topics relevant to rural communities. And as well, huge thank you to our sponsors for their continued support. Without them, the lecture series would not be possible. They include CIBC, Private Wealth Management, DeJager, Town Square, IDA, Pharmacy in Goderich, Zehrs Goderich, the Town of Goderich, Libro Credit Union, MacEwan and Feagan Insurance Brokers Goderich, Huron Telecommunications Cooperatives Limited, and McGee Motors. And then Gateway Center of Excellence in Rural Health is a not-for-profit organization with charitable status, and we greatly appreciate and welcome the support we receive. If you would like to donate to Gateway to continue to support this lecture series and other Gateway rural health projects, I encourage you to visit the Gateway website and click the donate button. Other methods of support include purchasing Gateway swag and merchandise, such as hats and hoodies from our online store. And then you can follow us on Instagram, Facebook, LinkedIn, and Twitter at Gateway Rural Health. We're taking a break for the summer, July and August, and we will return on September the 12th to discuss our project on cultivating memories. Thank you.
Right.
Thank you, Sage. And thank you to all my wonderful panelists. And if you could email me a list of the questions, I don't know if you can kind of see them. I'm happy to kind of keep answering those, and I'll, forward them out to the panel group for their opinion as well.
That'd be great. Thank you, Dr. Peel. And yeah, thank you for all the questions that came in. We'll do our best to get back to you by email, everyone. So thank you, everybody, and have a great day.
Thank you. Bye.